In this lecture, we're going to talk about some of the different diseases or disorders that can impact the cardiovascular system. So one thing that people can experience is called angina pectoris, and this is essentially just chest pain. It's caused by a lack of oxygen to heart muscles. This particular chest pain is definitely worth paying attention to because it often precedes a heart attack. Not a heart attach, as I accidentally spelled there. So angina pectoris is usually a warning sign for a more serious problem. So anytime there's chest pain, it's a good time to have that checked out by a doctor. A heart attack is called a myocardial infarction, or it's also called a coronary sometimes. This is when part of the heart is deprived of oxygen and dies. So it's heart muscle that has died. Myocardial infarctions can cause death. They can be pretty dangerous, and they're usually preceded by chest pain from angina pectoris. Congestive heart failure occurs because the pumping efficiency of the heart is depressed, meaning that it cannot move as much blood through the heart as it should, and it's caused by a weakening of the heart muscle. So it can result in pulmonary congestion and pulmonary edema, or peripheral edema and swelling of your distal body regions. So essentially, more blood is returning to the heart than the heart can pump out, and that causes the blood to pool in other areas of the body. There's also heart blocks when you have a damaged atrioventricular node, so the ventricles and atria do not contract in concert. There's ischemia, which is when there's lack of adequate oxygen supply to the heart muscle, or fibrillation, which is when you have a rapid, uncoordinated shuttering of the heart. So I think we talked about this in a previous lecture. Fibrillation is when the muscle cells are not contracting together, which is when you treat it with a defibrillator in order to ask those muscle cells to coordinate again, and that way if they beat in concert, they can move blood through the heart again. We've also mentioned in previous lectures tachycardia, which is when you have a rapid heart rate that's not due to exercise, it's your resting heart rate, or bradycardia, which is when you have a slow heart rate less than 60 at rest. Hypotension is low blood pressure, and it can be caused by poor nutrition or low blood proteins. Hypertension is high blood pressure, which can be dangerous if it's chronic. Again, hypertension is totally normal as a result of exercise. So while you're running laps around the track, you're going to have a higher blood pressure than you are when you're sitting in a chair. But if your blood pressure stays high when you're sitting in a chair, that's when it's not good. And here the heart is forced to pump against increased resistance for many years, which is why it can cause problems. This can lead to things like congestive heart failure, or it can also speed atherosclerosis, which we'll talk about in a moment. Risk factors for hypertension include diet, obesity, stress, heredity, things like that. And atherosclerosis is sometimes called hardening of the arteries, and it's when fatty plaques form within the walls of the arteries, and as those plaques form, they can narrow the interior or the lumina of the artery, and the artery can become less flexible. So if the artery is becoming less flexible and there's things that are bulging into the lumen, it can actually block off an artery, and that's why it can cause serious problems, because it can increase the risk of things like myocardial infarctions, strokes, and aneurysms. And there's this video, it's kind of horrifying. It's a surgery of a heart, an open heart surgery, where they actually remove a plaque from a blood vessel, and it's huge. It's like the size of a pencil. So feel free to watch it if you're not squeamish.